back and forth with the metronome. Tick, 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 tick. In terms of being able to stand upright, being able to walk places during vertigo, and alleviating some of my double vision, there was such tremendous improvement. I really can't express it in words. It gave me so much of my life back, and that means a lot when you're dealing with chronic migraines. Hey guys, welcome back to my channel, Momming with Migraine. I realize that we have a lot of new subscribers, and I'm really bad at introducing myself. So, hello, my name is Jen. I'm a service dog handler. I'm a brand new mom, 2 weeks postpartum with my rainbow baby. There are lots of videos on my channel about all of these things. Feel free to go check them out. But I'm really excited that you guys all stumbled upon me and wanted to hang out longer, so thank you for that. I'm humbled and I'm really excited to have you. I'm going to skip forward, so let's go. I'm probably one of the most ironic vestibular therapy patients that Stanford's ever seen. It came up in my Q&A last week that I did competitive gymnastics as a child. But what I didn't tell you is that I did make it to the state level in California, and while I was there, I won a gold medal on balance beam for my age and level. Fast forward 10-15 years, and I'm in vestibular therapy because I can't balance anymore. Life, man. I did do this whole video about my migraine onset and my diagnosis story, but the background information that's important here for this video is that my symptom onset was 2016. My formal diagnosis was like beginning of 2017, and when the migraines started, they were extremely vestibular, meaning dizziness. I was told that it's migraine-associated vertigo, MAV, or migraine-associated dizziness, vestibular migraine. I'm not sure how interchangeable all of these terms are, but all of them were used to describe me because of how dizzy I would get with my migraine attacks. In the interest of transparency and making sure that this all makes sense, I need to let you guys know that I really don't get that dizzy anymore. It's not at the level that it was back when I had to do vestibular therapy. So we're like 3 years out, and I'm trying to do this from memory. And as you guys know, my memory's not great. Thankfully, I did take pretty good notes because I knew that my memory was gone. So today I'm going to show you my very favorite exercises, or the ones that I found the most useful for the problems that I was having. And I'm very thankful that I get to say that I was having, because it turned out a lot of my vestibular migraines were due to a dairy fat allergy. I've found over the years that different triggers trigger different migraines. So if I have a beer, for example, I get a very painful migraine. If I have dairy fat, I get a very vestibular or dizzying migraine. Back at the time that I needed this vestibular therapy, I had no idea that I was accidentally poisoning myself every morning by putting cream in my coffee. Among other things, because I do like dairy and I knew that I wasn't lactose intolerant. I had no idea that dairy fat could even be an allergy. But now that I know, my dizziness is way less. It's still there, but it's less. Vestibular therapy is just like other forms of physical therapy in that it is tailored to the individual. There are many different reasons that people can experience dizziness, just like there are many different reasons that someone would go to a physical therapist for a shoulder injury. It's not a one-size-fits-all where, oh, my shoulder hurts, so you have to do these exercises and it's fixed. It depends on a lot of factors, your symptoms, how the injury happened, what the injury actually is, blah, blah, blah. So same thing with vestibular therapy. One of the very first things that they did was analyze why it was I was having dizziness problems. What they told me is that good balance depends on all sorts of things, like your visual system, which is the sensory input that you get from your eyes, your muscles, tendons, and joints, which makes up your proprioceptive input, and the balance organs in your inner ear. Your brainstem takes all the things, puts it together to tell you where you are in space. And they also mentioned that good balance depends on the movement of your eyes to keep objects in your vision stable and keep your balance, which is what they called motor output. So one of the very first things that they did when I went into vestibular therapy is they tried to assess which system it was that was causing my balance issues. I'll put the picture up here. This is my chart, and unfortunately I don't have the legend, but the big red area, the red bars, that is my visual input. All of my other systems were working very well, meaning my body, my muscles, my tendons are doing well, paying attention to where I am. The balance organs in my inner ear were totally fine. We also confirmed that with a CAT scan. However, I was having trouble with my visual stuff. I was overcompensating with my eyes, or overcompensating for my eyes. I forget which way it went. But I remember that these red bars meant visually something wasn't quite right. It was crazy to see that I was normal in so many ways and passing all of their tests with flying colors, and then this one thing had been wreaking havoc on my life for so long. I cannot tell you how many times sorry TMI, vomited at work for many, many months in a row, every day, because of this dizziness. I was unsteady in my walking because of this dizziness. I would tripod on things. We called it tripoding, where, let me put this down. I would grab onto a counter or something like this because I thought that I was spinning backwards so hard that I, stuck in my chopstick. I literally could not stand up straight because I thought I would fall backwards. So I just hold on to things in this crazy position. And it was just because of my eyes. Amazing. Once we knew what the problem was that was causing my dizziness, we moved on to what exercises would help me. You get exercises that are specifically designed to trip you up and make you feel dizzy so that you can learn how to deal with the dizziness, and over time you become less sensitive to the things that are causing your dizziness. That means for my treatment plan, we had to do exercises that really messed up my eyes and made it so I couldn't rely on just my eyes for balance, so that my other systems would learn how to compensate. And at the same time, I became more tolerant to the crazy movements that they were having me do with my head. I probably should have mentioned at the beginning, but I'm just remembering one of the biggest problems for me was head movement. If I bent down and then came back up, super dizzy, crazy. So things like doing dishes, doing burpees. Oh, actually, let me get my list. They had me make a list of goals at the beginning of vestibular therapy to decide what activities I was hoping I could resume, and my list was being able to do stuff in the dark, cleaning the bathtub, cleaning in general. I put large grocery trips. I didn't realize that the grocery store was really triggering because it's patterns, so many patterns. Patterns, actually, big migraine vestibular trigger for me. Emptying the dishwasher, and I noted that the up and down is difficult and the clinking was difficult. I also said I wanted to be able to do burpees again because I was doing CrossFit at the time, and burpees are life in CrossFit, and I couldn't do them anymore. I also put stuff like packing for trips because it's hard to remember a lot of things. I put folding laundry because of all the patterns. Video games like first-person shooter games, I couldn't really play so much anymore because going down paths was difficult for me. And rides. Tractor. I wanted to be able to ride on a tractor. My brother has a tractor. Coasters, boats, coasters. Oh, roller coasters, boats. Again, going down paths was difficult. So vestibular therapy is time to expose myself to all of those things. I feel like we're going to be like 10 minutes into this video before I even get to any exercises. But I feel like all this background info is important. And one more thing that's also very important before I get to it is that I'm not a doctor, I'm just a patient. That's the baby. I'm going to put it out there that this is for entertainment purposes only. I cannot recommend that you do any of these exercises. These exercises can be dangerous to do if you already have balance problems. These exercises are tailored to me, not you. They're tailored to my problem, not your problem, etc., etc. So please do not try this at home. Make sure you talk to your doctor before you start anything for your migraines, even if it's just exercises. And if you think that vestibular therapy would help you, talk to your doctor about going to vestibular therapy and making sure that you do it right. That said, I'm going to put the information out there. Let's do it. If at any point during this video you're like, oh, that's so helpful, or oh, Jen, you're so fun, hit the thumbs up button, and also please consider subscribing. It really does help support me. And if you hit the notification bell, you won't miss it anytime I post and upload. When you go to your vestibular therapy appointment, there are exercises that you do at the place that you can't take home, things that are like on a TV, or they gave me this exercise where this platform moved on the ground and I was in this big dome that did some virtual reality stuff while the ground was moving under me. The baby's making a ton of noise, I'm sorry. And then there are also some exercises that you do that you can take home, and they give you the props to do that. So this is called a Brock string, and this helped me so much with my double vision. It's just a piece of yarn, plain white yarn, and they put 3 beads on it. The way they told me to use the Brock string is the middle bead stays in the middle. The other 2 beads go towards the ends, not all the way to the end, but towards the end of the string. One end goes on your nose, and the other end, you hold it way out. Actually, let me switch hands. When you're holding the string out like this, there's now a bead right next to your nose. There's one in the middle, and there's one way over at your thumb. Once you're like this, you cross your eyes and try to focus on the bead that is closest to your nose. And they told me to get the bead as close to my nose as I could, where I could still see it in single vision. Look at that bead in single vision for a count of 3. 1, 2, 3. And then focus the attention on the middle bead, for me the pink bead. 1, 2, 3. Then the far bead, 1, 2, 3. And then back to the middle, 1, 2, 3. And repeat for 10 repetitions, 10 full cycles on the string. It's sort of interesting with this exercise. When you look at the string that's closest to your nose, what you should see is a V shape that converges on that bead. When you're looking at the middle one, it looks like an X. And when you're looking at the far one, it looks like an upside down V. So the string sort of changes its appearance as you're doing the exercise, which is weird. They actually started me out on a shorter Brock string, and I felt like it wasn't quite enough to help me with the double vision for watching TV, because TV is really far away, and I was only practicing in this little range. So they switched me to a much longer Brock string, but they do come in ranges. And this didn't quite end up being long enough either, but obviously my hand can't go any further. So what I started to do is I just stored the string on my nightstand, and right before bed, I would lay down in bed and hold it up over my face. And as a fourth bead, I would focus on the ceiling up above the bed. At first, I would have to do a couple of repetitions on just the string, and then I would be able to add the ceiling. But over time, I got better and better at it, and I started to be able to just focus on the ceiling. Now this is one of those things that ended up being super duper truly life-saving, because there were a lot of times that I was having double vision in my life, and I just didn't quite know how to correct it. And once I trained my eyes on how to correct it, I noticed that throughout the day, I would be looking at something far away, and suddenly my eyes would focus almost like a camera lens, like I could feel them focusing, and then suddenly the object became so much more clear because suddenly it was in single vision. I was suddenly seeing it with both of my eyes. Both of my eyes were working, which is like weird. I think a lot of the time I'm in double vision and I just don't realize it, because the stuff that's close to me is single vision. The stuff that's far from me is almost always double. So this guy, really, really cool. Really helpful. I just paused filming for about 3 hours because baby things came up, and then I was hungry, and then more baby things, and then I needed to pump, and then, you know, blah, blah, blah. And honestly now it's just kind of late at night. It's like almost 10. So I'm going to finish this filming tomorrow. So you'll see some clips where I maybe look a little bit different, or stuff is going to be in a different place, and then it might snap back to today, but that's what's happening. Good night. Good morning is what I was hoping to be able to say right now, but it's actually 3:30 p.m. and I'm just stepping in front of the camera. So we're going to play a little bit of YouTube catch-up here. You sweetheart. Causing all the delays, but I love you so much. All this is a little laminated piece of paper taped to a stick. It has to say smile on it because it's about to torture you. They had me download a metronome on my phone, one of those tap, 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 tap that's typically used for drummers. And that helps you keep time and let you know how fast you're going when you're doing the exercises. The first thing they had me do with this was swing my head around while I'm looking at it. Focus on the word smile, set the metronome to 50, and for 60 seconds, go back and forth on the metronome. Tick, 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 and then up and down. And I believe a week later, once I got good at those, we added diagonals in either direction, and that's all in like feet apart position. This is really nice. There's actually dates on it. So after a month of doing that every day, I got graduated to forward walking while doing the exercise, which is way harder. Going back and forth. They did say to be careful to not create a pattern with my feet. So for example, if I always step with my right foot while this is off to the right, and I always step with my left foot while this is off to the left, that's not as effective as switching it up. So I was told to just switch it up. At the same time, they added what I guess I'll call level 3, which is moving your head in the opposite direction, but keeping your eyes on the smile. And for this one, the metronome was at a much faster rate. It was at 110 instead of 50. So for that one, it's tick, 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 doing the up and down direction, and then also doing the side to side direction. Wow, I'm falling over. See, I told you it's been a while. And that was it with this guy. It was nice because we started out with the easier ones, and that made it so I was only doing 2 minutes of it a day. And as they were adding in the more advanced exercises, I was still doing some of the easier ones. So it got increased to like 4 minutes a day, and then 6, and then 8, and then 10. Probably not actually all those steps. It probably actually went from like 2 to 6 to 10. But it made a really big difference in my life because I was getting used to my head whipping around all the time. And I was training my body and my feet to be able to make up for the fact that my eyes were going all wonky. And that made it so that just day-to-day life ended up being so much easier. If you think about this logically, it makes sense that once you train yourself to stand still and do these crazy movements, and then eventually progress to walking and doing all these movements, suddenly your world opens up because now you're maybe able to walk and look at something at the same time and not lose your balance. And coming from a place where you're so dizzy all the time and you fear falling all the time, it's just really liberating to notice that, to notice for the first time, like, oh, I was in the grocery store and I just nonchalantly looked up at something. Like, that's incredible. That's so freeing. And that's not something that you often get to feel when you're battling chronic migraines. Okay, so some more exercises. Twice a day, I also had to do a very slightly modified version of this, where this is further away, not just in my hand. So my distance was 5 feet away, and to be honest, I didn't ever really use this. I would use something like a clock on the wall. Actually, for the sake of the video, I can just show you using the camera. I focus on the camera, have the metronome at 120, so that's faster than any of the other ones that I've told you about so far. And keeping eyes on the camera, I'm about 5 feet away and looking back and forth with the metronome. Tick, 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 tick. I'm losing track of dates, but however long after that exercise, once I got good at that exercise and it wasn't that triggering for me anymore, they had me put wallpaper on the wall that had a crazy pattern that I found triggering, and then I had to put the smile in the middle of the wallpaper. I should face that towards you. And do the exercise again, but this time the crazy pattern was screwing with my eyes. So that's how we leveled up that exercise. This is, again, one of those things that just teaches your eyes to focus, teaches you to ignore the way that your brain is moving, and it was another one that just added a lot of freedom to my life. Ooh. And on the wallpaper, I got to graduate to 140 beats on the metronome, which is pretty impressive, I think. This is my YouTube, I'm going to say it's impressive. There. The next one, I called it drunk walking. It was looking side to side while walking forward in a straight line. And this is another one where they said, don't make it a pattern with your feet. Make sure that you're switching it up. So you look to the right for 2 steps, look to the left for 2 steps, look to the right for 2 steps, look to the left for 2 steps. And then later on, switch which foot is stepping first so that you don't just learn how to do it in one direction. I was also doing that exercise looking up and down. Once I got good at that, they had me do the same thing but walking backwards, which for some reason throws everything off. So rinse and repeat literally the whole thing but walking backwards. And then they had me do it with my eyes closed, which is nuts because now that I'm out of practice, I can't imagine doing that. That's terrifying. And they also had me add twirls. So step 1, 2, 3, twirl in one direction, step 1, 2, 3, twirl in the other direction. I wonder if I can even do that. Yeah, okay, I'm gonna start doing vestibular therapy again. This is ridiculous. These are so hard for me now. I was also assigned to try to watch a triggering YouTube video for 3 minutes. So the search terms that I would look up are things like optokinetic, which is weird shapes and stuff, walking in Tokyo or London. Again, those paths are very triggering for me, so it was a way to practice going down paths without actually needing to walk down the paths myself. Driving on Highway 1, a busy grocery store, optokinetic training, that's something that you can search too. And GoPro biking backflip by Kelly McGarry. I probably told her that I liked watching GoPro bike videos. At that time, GoPro was like a really big hip thing, so it was really fun for me to watch, and it made really perfect vestibular therapy. The way to ease up on those videos, other than time, is to slowly increase your screen size. So watching something on a phone is going to be much less triggering than watching something on a giant TV. So starting on the phone, if I can get through 3 minutes of that, then the next day I would try it on a tablet or a computer, and eventually I got to the point where I was using our big TV, and we have a big curved TV. So I would stand within the curve and watch these objects kind of go by me, and I would practice balancing while my eyes were being tricked by what was on the screen. And just like scrolling through the results here, there's patterned carpet hallway for optokinetic training, more crazy patterns, some vertical stripes. These ones, I've watched this one before. It goes off to the side. Oh, there's me. Be nice to mean people. It's great advice. This is one that I know I've watched before. It's just a busy grocery store. It's a really triggering environment, so it's a good thing to practice at home. And I never had any idea that you could just do that kind of training on the internet, but it worked. I'm back again, back a third time, because there's a whole nother set of exercises that I totally forgot about. But I'm going to try to make this really fast because the baby is about to start crying because she's hungry. This set of exercises uses a ball. It's easier if it's brightly colored, and it's best if it bounces. I was using one that was like this big, maybe tennis ball size. A tennis ball would work great. And I don't have a ball with me, so I'm using my freezable migraine mask thing. Level 1 was just throwing the ball back and forth to myself, making an arch, and tracking the ball with your eyes. Once I got good at that, they added walking, so being able to walk while you're doing that is level 2. Level 3 is over the head, adding a half spin. Whoa. Whoa. Clearly I need to practice again. It's been years. They had me switching directions each throw, or doing 2 in one direction and then 2 in the other direction. And then level 4 is the same thing, and I can't actually demonstrate it all the way with this one, but basically the point is you go over your head, allow it to bounce. Once it bounces, catch it, and do that over and over again. And adding the bounce makes it so that instead of just looking up, you're also adding looking down. So that's even more dizzying because of the increased range of motion. I'm so glad that I remembered to squeeze those in, because those are super helpful too. All right, interruption's over. After 2 months of doing these exercises, they had me redo the assessment that they had done at the very beginning of my training. And as you can see, I improved a lot, especially in the area where I needed to improve. My all red turned to all green. Hard work paid off. And much more important than that was that I felt better. I felt more confident. I felt sturdy on my feet finally. One thing that's a little bit weird about the results of this is now I rely on my feet a lot, and I'm really good at feeling the ground under my feet. And that works really well on flat ground, but if the ground moves or if the ground is diagonal and I don't notice it, I will just tip in that direction. Last summer there was a night that I was walking on the sidewalk, and the sidewalk turned into a driveway and then back into a sidewalk, and I didn't notice that it had that angle coming up before it went back to a sidewalk. So I'm walking, and suddenly I'm off to the side. I think I probably grabbed onto my husband or I fell into somebody, but it's kind of funny because I need to be pretty well tipped before I notice that I'm tipping. I have to notice it from myself moving, which isn't always easy to do when you're walking, but that was pretty funny. There are still definitely some imperfections in my methods of balancing, but I'm really happy with all of the improvements that I did make, and I'm glad that I've gotten back as much as I have. Not everybody can make significant progress doing vestibular therapy exercises or any physical therapy. It depends on you. But for me, for my problem, it was highly effective. That's all the exercises that I have for you today. Again, I really can't recommend that you try them at home. But I hope that you found this video interesting and informative, and for a lot of you, I hope it gives you hope, because depending on the cause of your dizziness, there could be something that you could do about it, and that's really, really exciting. There isn't always a lot that we can do to escape from our migraines, but anything that could possibly help symptoms, why the heck not, right? Vestibular therapy was very, very difficult to get through. It's a very triggering experience, and you really need to have your mind tight if you want to be able to get through the program. However, in my case, I am a whole new woman, and I mean that before I figured out the dairy fat allergy thing. And if this video got you excited or this video gave you hope, please go talk to your doctor and see if there's something like this that you could do for your migraine symptoms. I'm looking forward to seeing you again next week.